The system also conveniently charges with a wall cord plugged in here, so we can keep the unit charged on the wall, or if there's ever a failure in the system and it hasn't been charged, we can remove the battery and switch it with the wall-mounted battery. As a last resort, if the system ever completely failed and we needed to lower the patient down, we can always do that with a manual override. Just pull the lever and the system lowers the patient down comfortably. Elderly and mobility impaired individuals sometimes require assistance into a standing position. The Stand Assist device is the perfect product for standing that patient. Working from the bottom up, you can see that the unit rolls around on 4 casters. We can use to push the device into different positions. We can open and close the base by pushing the foot pedal on the back of the device. At the bottom, we have a foot tray where the individual's feet will be placed during the transfer. The knee brace is adjustable into different positions, so we can set that so it's comfortable for the patient during the transfer. Of course, the unit runs up and down with an electric actuator that will make the device raise and lower when we push the buttons on the remote. At the very back of the lift, you can see that there's an emergency stop button that when pressed, the system completely stops. We also have a display on the back to show how much power is in the battery at any time. We also have that same display on the battery itself. When we push the button, we can determine how much power is in the battery. If the remote was ever to fail, we can raise and lower the lift with the auxiliary buttons on the control box. The removable battery pack allows us to take the battery from the unit and replace it at any time if we need power. Of course, if the system completely fails, we can lower the unit down by using the emergency lowering function on the actuator itself. The hooks on the device are going to be used for the different sling applications for standing the patient up.